Hi, Dr. Friends. I am Dr. Santosh Jha. Today's topic is in the microbiological chapter in the serological test. I am asking about some important topic which are mainly for the upcoming NEET PG exam and most commonly asked question, and not asking about the complete theoretical knowledge in the serological test. So main topic, start with serological test. Without a wasting of time, I am starting with the serological test. First start with the precipitation test. Precipitation test, it is a soluble antigen. This is the most commonly thing which are asked. Next one is in the precipitation test. That means precipitation test is also a flocculation test, so don't be confused. Precipitation test is of following types. First start with the tube flocculation test. Example of such is contest for the syphilis. If you see the figure of such test, here the image of the tube flocculation test, it is used for syphilis contest, and in this serial dilutions of toxin or toxoid added to fixed quantity of antitoxin. Amount of toxin and toxoid that flocculates with fixed quantity of antitoxin is defined as 1 Loeffler unit dose. This is the tube flocculation test. Example you have to remember, example is contest for the syphilis, and image for such is here. Next one is slide flocculation test. The example for such is VDRL test. If you see this, the diagram, if the antigen and antiserum indicates the antibody, placed on the slide and mixed by shaking, appearance of floccules, that means this is the dotted structure is floccules, and if there is no reaction, then it is like that. If weakly reactive or weakly positive, floccules are appear like such dot, and if strongly positive, this is bunch of dot, so you can easily recognize by this. Next one is the ring precipitation test. Example, Scully's thermoprecipitation test or lens filled test for the streptococcus. Here you can see the ring precipitation test. Here the antigen or antibody are present, and here the reaction occurs. So it is the diagrammatic representation, while that of actual figure of such is here, yellow color. That means the layering of antigen solution over the column of antiserum in the narrow tube, and the precipitation here, precipitate are at the junction. So example for such is Scully's thermoprecipitation test and grouping of streptococci by lens filled test. Next one is the complement fixation test. The example for such is Wassermann reaction for the syphilis. Here the complement fixation test was extensively used in syphilis serology, and complement protein is the globulin present in the normal serum, and here the complement system is made up of 9 complement system C1 to C9. Complement protein are hit level and destroyed by hitting at 56 degrees C for 20 to 30 minutes, and complement bind to antigen antibody complex, and when the antigen is an RBC, it is causes lysis of RBC. Here if you see, the component of complement fixation test is the test system. That means antigen, patient's serum containing antibody, and complement fresh guinea pig serum. You have to remember antigen or patient serum containing antibody and the complements. Complements will be complements present in the guinea pig serum. Indicator system is complement fixation diluent rich in calcium and magnesium. Question asked. And this and sheep erythrocytes. Okay, and emboceptor, that means antibody to sheep erythrocytes. If you see the image, the serum with antibody or serum without antibody, that means antigen binds with here black dot, antibody bind with antigen, and complement then bind to here pink color, and hemolysis sensitized red blood cell severe as serve as indicator, and RBC settle down, that means no lysis, that means it is the reactive, and here the antigen antibinding are not present, so unbound component are present, so complement pink color are not bounded to antigen antibody complex, so hemolysin sensitivity sensitized RBC serve as indicator, and RBC lysed by the unbound component, so it is non-reactive. Next one is immunofluorescence test. It is of direct test or indirect test. Direct test, you have to only remember direct test for the viral antigen detection, that means the rabies antigen detection, and indirect test, it is FTAABS in the syphilis. And most commonly asked question about the syphilis test is the, always you have to remember FTAABS. Okay, not VDRL test. For confirmation, FTAABS test is the most confirmatory test for the syphilis. Next topic is agglutination test. Agglutination test, the here particulate antigen is used. Here the example will be gums test. Here the type of such is tube agglutination test. Tube agglutination test, here example is the Vidal test, Well-Felix test, and Paul Bunnell test. For it is also all three are asked previous year, so you have to remember such test. Example is Vidal test, Well-Felix test, and Paul Bunnell test. Vidal test is used for typhoid fever, and here infectious mononucleosis. Paul Bunnell test, and you can remember it by the trick for such is WPW, Wolff-Parkinson-White syndrome. Next one is slide agglutination test. Here the blood grouping and cold agglutinin test are example. Next one is the latex slide agglutination test. Here the cryptococcal antigen in the CSF and ASO titer estimation, or also called as ASLO titer estimation. Here the passive slide agglutination test used for Rose-Waller test for the rheumatoid arthritis and a streptozyme test. Here you can see the indirect immunofluorescence test. Here the two antibodies are used, primary antibody and secondary antibody, which is a fluorescent labeled reagent and a reagent. Fluorescent level secondary antibody complement protein A. Example is fluorescent treponemal antibody test. So you can see the figure of indirect immunofluorescent antigen test. Next is direct immunofluorescence staining. Here example for the here rabies viral antigen and direct immunofluorescence test for the detecting antigen in the tissue using a specific antibody labeled with fluorescent dye. For identification of virus bacterial membrane bound antigen, sensitive method for identification of a rabies viral antigen in brain smear. You have to remember brain smear of, for the detection of the rabies viral load. If you see the type of agglutination reaction, this is direct agglutination, indirect agglutination, reverse agglutination, latex particle agglutination, inhibition reaction, quantitative agglutination reaction, heme agglutination reaction, viral heme agglutination reaction, and viral heme agglutination inhibition reaction. This is the type if you want to remember, so you can easily remember by this topic. You can make a note, but important topic I have already told in my own handwriting. It is the external thing for which are preparing for second year microbiology chapter. Thanks for watching my video. Have a nice day. Any advice to uh, me regarding this video, you can comments on my comments box without any hesitation. Thanks again for watching my video. Have a nice day.